Hello, everyone. Thank you so much for joining us tonight. It's great to see you here. I'm Catherine McMahon. I'm the program manager at Lupus LA, and I've had the chance to email with a lot of you and talk with you on the phone, so it's really nice to see you here in person. Please do visit our website if you haven't already at lupusla.org. You can learn more about all the services that we offer. We have a really great support group program. You have the flyer in your folder, and we also have extra copies of it on our info table. If you haven't had the chance yet to come to a support group, please come. They're a really great opportunity, a really great resource. You can connect with other people and receive a lot of good support that way. We also have an emergency grant program that can help with medical bills or your insurance premium. We have a lot of great support services. So if you have any questions about anything, you can come see me on break. You can call me or email me anytime. Your information, my contact information is in your folder. So please reach out. Tonight is a good opportunity to learn and to ask questions to the wonderful doctors that we have here with us, but it's also a great opportunity to connect with each other. So talk with each other, exchange contact information. We're all here to support each other. I'm going to keep the introduction quick because we have a lot of great presentations to get started with. So our first one is going to be with Dr. Santu. So please help me in welcoming her.
Hi, everyone. Can you all hear me okay? Yes. How many of you have attended this specific talk in Loma Linda before? So we have some new people. Welcome. This is home for me. So I'm from Corona, and I did my residency here at Loma Linda, and I trained in LA and came back to work here. So I'm really excited every time we have a lupus talk here. It's very near and dear to me. I have a lot of patients here, and I love serving our population here. So thank you for being here. Let me see if I can not do that. There we go. Okay, so I'm going to be talking with you today about lupus diagnosis, flares, and the latest research. I'm going to try not to be too boring. Some of the stuff will be very useful, and some of the stuff I'm going to try to skim through, and if you have any questions, please bring it up at the end of the talk. Think of stuff as you hear the lecture, because hopefully it's not actually a lecture, it's an interactive session. So what I'd like to go over with you today is lupus, what it is and why does it happen. We, by the way, don't know the answer to that, but just we can try. Signs and symptoms of SLE or lupus, and then the treatment of lupus and whatever ongoing research I could bring into this session, because there is a lot of stuff going on. So lupus is an autoimmune disease, which essentially means we don't really know why it happens. It is of unknown cause, but essentially your body is attacking itself by creating antibodies that attack your tissues. It is multi-system, which means it can attack multiple organ systems, and organ systems go from head to toe, heart, any organ, your skin, joints, and so on. It is chronic, which means it is long-term. I have some patients that have gone into what we call clinical remission, but ultimately we think of lupus as chronic, long-term. That's why you're all here today. We are all here together in this journey. But even though we're all here together in a lupus session, no two patients have the same disease. So you can talk amongst each other, and one might say, oh, I have this too, you have this too. Doesn't mean it's going to be the same ultimate outcome. It doesn't mean you're going to have the exact same response to treatment. Somebody might respond better to one thing, somebody else might respond better to something else. So this is what I'm going to talk about. Not really, it's a little bit too intense. If I was somewhere else, maybe I would talk about this, but I will touch on some of these things. This slide is just an example of how complicated lupus is. And what it is this is your B cell, your T cell, and some other cells that come into play. And these are all of the targets for where multiple different medications can act to treat lupus. So that's why no two patients with lupus actually get treated the same way. You might have this generic, everybody gets Plaquenil, a generic, the first step might be X, Y, and Z, but there's a lot of stuff that can be used to treat lupus. So what causes lupus? It's a combination of things. So your body might lose tolerance, so your ability to identify your own cells and potentially create antibodies against your own tissues. That's your loss of self-tolerance. And then there's genetics. So maybe a parent had it, maybe no one you know ever had it, but genes were still passed down. And then environmental triggers. And this is something that's really important for all of us because that's something that we can actually do something about in some cases. So some examples of environmental triggers: hormones, infections, medications, sun exposure. There's some links with vitamin D deficiency and lupus disease activity, smoking, stress, and other toxins. So in my experience in practice, I have actually heard so many stories of what preceded the diagnosis of lupus. And it's usually something. So it might be that you have some sort of a genetic predisposition. So some gene was passed along, and then maybe somebody got into a car accident. I was fine until that car accident, and then I started getting a rash. Or I was fine until I got pregnant, and then my kidneys took a hit. So there's often some sort of a trigger that I find patients telling me about, and it's seen in the literature. This is what we found in research as well. So this process of things results in autoantibody production, and this just means that your body is producing antibodies against itself, and that then results in inflammation and tissue injury. Moving forward, so characteristics of patients that have lupus. This is just a summary. So at least 85% of patients with lupus are women. So if you are a man with lupus, you are a large minority, and men with lupus tend to have a very severe form. Okay. As far as sex, race, and ethnicity, this is just an example of showing that ethnic minorities tend to have a greater prevalence of lupus. So it's just seen more, and it's more severe in ethnic minorities. That doesn't mean that's always the case, but it is something that's seen. The ratio peaks in the reproductive years. So this is kind of what we typically see. So a lot of times when I tell people I'm a rheumatologist, they say, oh, so you must have a large elderly population. And I just say, no, that's not how this works. It is also found to be organ threatening in at least 50% of patients. So organ threatening can be anything, but we're talking like seizures, kidney disease, heart disease, lung disease. So we see that in 50% of cases. This is interesting, an article that was published in 2017. It showed that in California, the largest prevalence of lupus is in Blacks, then Hispanics, then whites, then Asians. I say this to take it with a grain of salt though, because recognizing the region, so this was mostly done in San Francisco, Northern California area, that will be different from Southern California area. And when we look at research, it really depends on where the research is being done. So like here we have a lupus registry, and I would say the majority of my lupus population is Hispanic. So it's just going to depend on where you're at. So signs and symptoms of lupus. I like this slide. I think it sums up everything. So lupus is a prototype disease that behaves immunologically like a poorly controlled chronic viral infection. I ache, I get low-grade fevers. I just don't feel good. I don't feel good all the time. And that's kind of this prototypic, and you get inflammatory markers that are elevated. So, and the immune system is activated in a very similar way that a chronic viral infection would cause. Organ involvement, so like I said earlier, it can head to toe, it can affect any part of you. The next few slides are examples of where lupus can be involved in your body. So we've got, I'm not gonna try it. Oh yeah, I guess I can. So we've got top left and right here in the middle, we see two examples of lupus arthritis. And the top left is just inflammation in some joints. This bottom portion, actually, if you look at the, can you all see it clearly? If you look at the left side, you can see deforming changes on the left side. And then this person put their hands straight against the flat surface, and those deformities actually cleared up. So that's called Yakud's arthropathy. It's seen in lupus. And essentially, it's different from rheumatoid arthritis. We have patients that see that and they think I have rheumatoid arthritis, which you can have. You can have an overlap of lupus and RA, but lupus by itself can cause the same deformities of RA, but it's reversible. So you can flatten your hands out and it comes back, and that's because those deformities are happening because the tendons in your fingers, the ligaments, they get lax. the lupus causes laxity of your ligaments and tendons. So that causes you to have this, these deformities. This is your classic butterfly rash, seen here and here. These are more prominent examples, but I have patients that come in that just look a little bit pinkish. I always ask, are you wearing blush today? Because it looks almost like you're wearing blush. We call that a malar rash or a butterfly rash. Oral ulcers, Raynaud's phenomenon, which is basically poor blood supply to the tips of your fingers, toes. I've had some patients have it affect their nose. Years ago, I had somebody tell me it was affecting their tongue, and sure enough, their tongue actually had changed color. So it basically means poor blood supply to that, your distal portion of your body, okay? Bottom left corner is an example of a discoid rash. So I'm gonna go over some of the skin manifestations of lupus, but basically it can affect any part of your body. This is all skin lupus. So top left, these are all slides from the American College of Rheumatology website, but top left corner, I actually had a patient come in just like this. I admitted her to the ICU because she looked like a burns, it was like a burns victim. That's what it looked like. And she had gone to a taco festival for an hour and said, this is what happened to me 1 hour of being in the sun. So we ended up giving her high doses of steroids, gave her all sorts of stuff to clear it up. But that's one example. The two pictures next to that, you can see those little divots in the skin. So that's inflammation. It's less common, but it's inflammation in the fat beneath the skin that happens in lupus. That's called lupus paniculitis. And what it is, you feel it. I frequently see patients have it on their arms. It feels like these painful lumps. And then when the inflammation heals, it sucks in that portion of your skin. So it's these lumps that heal into divots. So I've got patients that have that problem. And then we have our dermatology or plastic surgery colleagues do fillers to try to help smoothen it out because it can be debilitating. It's your skin. Top right, this is an example of discoid lupus. This can also be very debilitating. So, I mean, this is some serious stuff we got to treat aggressively, okay? And then more examples. So this is all cutaneous lupus or skin manifestations of lupus. These are the less physically present, more internally present manifestations. So we've got a chest x-ray that shows that there's fluid around the lungs. Right next to that, fluid around the heart. Here is a stroke that can happen from lupus, and the stroke could be because of either a bleed or a loss of blood supply to the part of the brain. Here's brain atrophy. This is an example of some blood cell abnormalities that you can see in the on blood samples. And then the bottom right is a kidney biopsy that shows glomerulonephritis, so involvement of the kidney. And then this is what we call the lupus intangibles, what a lot of patients have and there's no explanation for. So many of my patients will have achiness, headaches, fatigue, memory fog, depression. I have no idea what's going on. And this is, I feel like, one of the toughest things to manage. Everything else I can say, okay, well, we'll do this, we'll do steroids, we'll do Cytoxan, we'll do Rituxan, whatever we have to do, we'll figure it out. But when it's this, we don't know what's what and we don't know what's causing what. So brain fog I want to touch on because that's a huge thing that a lot of my patients have. I see some people shaking their heads. So I think a lot of you experience brain fog. Now the tricky thing with brain fog is we don't know why it happens and we don't know if it's from lupus even. So we know that in lupus, you can get vasculitis, you can get inflammation of your blood vessels. You can get something called TTP, thrombotic thrombocytopenic purpura. You can get neuronal toxicity, whether that's from the lupus itself or from the medications used to treat lupus. So those are three examples. You can also have antiphospholipid syndrome by itself or as a part of lupus that can be associated with brain fog, including the meds used to treat it. Stroke can be separate from lupus. You can just be somebody who has you might have lupus, but you might have a stroke that's not related to your lupus because that can happen. People get strokes without lupus happening. And then medications either used to treat lupus or even other medications. Maybe you're on something for pain and that's causing you to have brain fog. Depression can cause brain fog. Meds used to treat depression can cause brain fog. Sleeping problems can cause brain fog. So if you don't sleep well at night, if it's because you have insomnia, you have restless legs, Maybe you have sleep apnea. That's going to cause you to have brain fog, because if you're not well rested, then how can your brain be functioning properly, right? So these are all things that are really difficult to manage as a provider, because a lot of times we don't know what's going on. So what we try to do is tackle each thing individually. So how are you sleeping at night? Have you had a sleep study? What kind of medications are you taking? Can we minimize some of the stuff you're taking for pain? A lot of times it's trial and error, and the biggest reason for trying to figure it out, because, and this applies for anything, any symptom that you might have as a lupus patient, is the easiest thing to say is it's from your lupus. That's the easiest thing to say, because we can always treat it. We can always give you something for it. But the worst thing we can do is just that, and just say it's lupus, let's give you something more for it. But then we're lowering your immune system more. We're increasing your risk for infections. We're increasing your risk of other side effects from the medications. So really making sure it's not other stuff. That's why any patient that comes into my clinic, I usually will tell them, just don't, make sure that this person checks out everything else, because if it's your lupus, I can help you with that. But if it's not your lupus, then we're kind of at a loss, because I'm messing with your immune system. So we don't want to be doing that if we don't have to. Okay, so diagnosing lupus. Diagnosing lupus is tricky. So it's a combination of the symptoms that you're presenting with, the signs that you're presenting with. So I feel so-and-so, and my provider sees so-and-so. They see a rash. They see there's something wrong with the way I'm walking. Maybe there's a foot drop. Maybe I've had a seizure. And then the diagnostic testing. So the diagnostic testing might be blood tests. It might be getting a kidney biopsy. It might be getting a skin biopsy. Those things help make a diagnosis, because the blood tests alone are really tricky. And I'll kind of touch on that in the next slide. But some imaging also will help us. So if you have chest pain, you have shortness of breath, we get a chest x-ray, we see you've got fluid in your lungs or fluid around your heart, that's going to be helpful for us to kind of gauge, okay, is this coming from your lupus? Combining it all together with blood tests, urine tests, your symptoms, that's really how we diagnose lupus. How many of you have heard of this blood test? Okay, so this is the screening test for autoimmune disease, not for lupus, but for autoimmune disease. So a lot of times patients will get an ANA test done and they'll be told straight off the bat that they have lupus. That's not the case, and that's why I gave you that last slide, that it's a combination of things. So the ANA blood test is used to screen. After that, we get all the other antibodies that might be associated with lupus as well, okay? So 99% of patients with lupus have a positive ANA. But an ANA can be positive if you have thyroid disease, if you have MS, if you have an infection, if you're on your period, a lot of things that can cause an ANA to come back positive, but it's the other stuff that's going to help actually make the diagnosis. Okay, so how do I know if I'm flaring? Lupus flares often can be vague. They might feel like I'm just flu-like symptoms. I just feel really tired. I'm having more aches and pains, maybe a rash that you might have had before or a new rash, fevers, chills, night sweats, joint pain, joint swelling, chest pain, shortness of breath, among other things. I've had seizures. I've had a lot of stuff happen. Raynaud's getting really out of control. Somebody had a stroke. A lot of stuff that can present with lupus. So it can always be lupus, anything that you have. But if you go to the emergency room with a problem, you better make sure they check you for everything else too, because we don't want to miss the important stuff too, okay? Lupus, remember, we can always treat that. We can always give you high doses of steroids and give you something really heavy duty, but we want to make sure it's not something else. So we use blood tests, urine tests to evaluate for lupus flare. So I want you all as patients and provider or caregivers and family members to know what we look for when we think of a lupus flare. We're always looking at your complements. Are your complements low? So C3, C4. These are proteins that are in your body, and it doesn't apply to everyone, but it is very helpful in those patients in whom it applies to. So these are proteins in your body that when your lupus is active, they get low. So that's when you are one of those cases that happens to, it's very helpful, because we say, well, your complements are low, I'm afraid you might be flaring. Your double-stranded DNA antibody is high, I'm afraid you might be flaring. There are some patients I have that always have low complements. that always have a high double-stranded DNA, and so those tests aren't helpful. But a lot of times they are, because I can identify somebody who's not feeling well, and their C3 and C4 is dropping. Now their white count is starting to drop. Platelets are starting to drop. They're starting to have more aches and pains. That is a lot, that combination of blood tests, urine tests, and their signs and symptoms help us know how systemically you are, how you're doing in your systems, and if you're flaring or not. And then we always check a urine test. So if you have lupus and you haven't had a urine test done in the last 3 to 6 months, maybe you want to ask your rheumatologist or primary care provider to check, just because it's important to check every so often to make sure you don't have any protein in your urine. And if you have known kidney disease, all the more reason to. Okay? So the treatment of lupus is complicated just like everything else. It's a combination of things. So there are medications that the provider will give you. We have a couple of docs here today, Dr. Du and Dr. Yu, who are going to be talking to you about some lifestyle and other coping measures, things that can help manage lupus from a non-medicinal standpoint. But so there's the medications, there's naturopathic treatments, which I think it's going to be touched on a little bit, complementary medicine, some other supplemental treatments, social support, kind of like something like this, or even just home, family, friends, and then behavioral therapy. So we'll be touching on some of these things today, but these are really important because all of the medicines in the world will not treat you alone. You always need something more. I'm a firm believer in you have to have something internally that helps you go on. It cannot just be the meds that we're giving you, because that's not going to help. So that alone won't cut it. And I will talk a little bit about medications, but that's not what this talk is for. This is supposed to be to help empower you as patients to be comfortable with this disease and do something about it, okay? So proactive and preventive strategies in lupus. So patient education programs like this, attend these, get more information, reach out in the community, go, seek all the information that you can so that you can ask questions from your provider and really embrace this and don't let the disease control you. Specialist access. So I work at one of the county hospitals in Moreno Valley as well. That's in this area, San Bernardino, Riverside County, we have about 3 million people, and coverage to have the right number of rheumatologists is not ideal here. So that's really important for a patient with lupus to have access to a provider, to be able to see a rheumatologist every 3 to 4 months, and some patients every month. So having access is so important. And if it's not with the rheumatologist every month, somebody who's able to monitor you monthly if you need that. And then cognitive therapy, biofeedback, we're going to touch on. Antiphospholipid antibody screening and prophylaxis. How many have heard of antiphospholipid syndrome? Okay, so this is a syndrome that can be seen in people who have lupus. It can be by itself, it can be associated with lupus. Patients who have lupus ideally should know if they also have antiphospholipid antibodies, just because that does increase your risk of clotting. Doesn't mean something has to be done about it, just knowing your status. If you have other risk factors, then you may be somebody who needs to be on a baby aspirin every day. So just having that knowledge and understanding if you need to be on aspirin or not. And then this is kind of easier stuff. Treatment of your high blood pressure, your diabetes, cholesterol. Do you smoke? Do you need to lose weight? There are a lot of things that get neglected in the process of treating your lupus. And as rheumatologists, we often neglect these other portions because patients tend to see us, especially if you have a severe form of lupus, you probably see your rheumatologist more than you see your primary care doctor. But your rheumatologist is not your primary care doctor, and you don't want to rely on them wholeheartedly on covering all this other stuff. If your rheumatologist does do all of this, great. But ideally, you're going to want to have a primary care provider that manages the rest of you, because that is probably going to help with your overall care. So physical measures, sun protection, sun protection, sun protection. If you have lupus, even if you say, I'm not sensitive, it doesn't affect me, some people are more sensitive. You guys saw the pictures. Some are more sensitive than others, but sun protection, sun protection, sun protection. UVA and UVB. It's not just the generic SPF. It's usually a titanium-based UVA, UVB sunscreen I believe Neutrogena makes it, but I know there are other companies that also do. Moderating your temperature, some people just do horribly in the heat, and then others do horribly in the cold. So know what you're sensitive to, because no two people with lupus are the same, and adjust your life accordingly. Be warm when you need to be warm, and be cool when you need to be cool. Okay? Exercise, so as much as you can do. I always say exercise doesn't mean you're running 5 miles a day. Even if all you're doing is stretching every day because you can't do a lot of physical activity, stretch. Do your body good, because stretching shouldn't be that difficult. And you should stretch as much as you can. So I understand everybody's at different points in their life as far as pain goes, but if you can find a point that you're comfortable with to be able to stretch, stretch. And then once you're comfortable stretching, start incorporating some cardiovascular physical activity in there too. Because remember, something is better than nothing, right? So if you can get some physical activity in, it's better than nothing. Diet and vitamins, I think we're talking about that a little bit later. Management of fatigue. If you have that's a huge thing. This week alone, I think 80% of my patients have said, I just feel really tired. Part of it is probably the weather, messing with a lot of people's systems. Either they're sick, they've been sick, or just the weather makes your joints ache more. But fatigue is huge. And I mentioned vitamin D deficiency. Always make sure if you're feeling really tired, just make sure you've been evaluated for that too. Because vitamin D deficiency will make a person feel more tired. And then it also amplifies pain. So if you have vitamin D deficiency, you're more likely to have muscle aches and pains, joint bone pain. And then the vitamin D deficiency also messes with your immune system. So it can actually predispose you to having a lupus flare. Trying to zoom through this. So cancer screening, this is another reason to have a primary care doctor. Your rheumatologist might forget that you need a pap smear, you might need a mammogram, you might need a colonoscopy, prostate screening, whatever age appropriate cancer screening you need. If you have a family history of breast cancer, or if you are at the age where you need to be screened for breast cancer, please be screened. Rheumatologists might not remember, but you should make sure you have a primary care doc that helps you get through all of this stuff, okay? Pap smears, all of that, okay? And then risks with medications. So some of the medications that are used to treat lupus may increase your risk for cancer. And it's not usually as much that the medicine causes cancer. It might be that you are already at a risk for cancer. So if you were to develop cancer, we would need to stop some of the meds. Commonly used medications. So NSAIDs, so non-steroidal anti-inflammatories like ibuprofen, Advil, Motrin, Aleve, naproxen, meloxicam. These are things that we use to treat inflammation, treat pain. I prefer these medications in people who might have joint pain, joint swelling. And then if it's not enough, we alternate that medicine with Tylenol because you can actually mix the two. But you can never mix your Motrin with your Aleve or ibuprofen with meloxicam because they're brother and sister, so you can't mix the two. You can do Tylenol with these things, but you cannot mix the ibuprofen with the naproxen or any of that because it can cause you to have stomach problems and kidney problems and all sorts of things. We don't recommend for pain. Ideally, we don't recommend narcotics just because they lower your pain threshold. I understand a lot of patients are on narcotics, and that's okay as long as you're being monitored. But for chronic pain, we don't typically recommend narcotics because it does lower your pain threshold overall. Antimalarials, so Plaquenil or hydroxychloroquine is the more commonly used antimalarial for lupus. We will tell our patients that Plaquenil should be in your water. That way at least you're getting it, because some people don't like taking it. But Plaquenil is the standard. Every single patient with lupus should be on Plaquenil, unless you've had an allergic reaction, if you've had some sort of side effect to it. I've had patients with upset stomach, skin problems, an allergy, eye problems. So barring those other things, you should be on Plaquenil. Other antimalarials might include chloroquine. So I've had some patients on chloroquine, but it's usually Plaquenil. Steroids like prednisone or methylprednisolone are used to treat inflammation. I'm going to be talking about that a little bit more. Immunosuppressants like cyclophosphamide or Cytoxan, Imuran, Cellcept, methotrexate. I'm going to try not to talk too much about these, but there are some of the ones that we use. And then Benlysta or belimumab is an antibody that's used to treat, monoclonal antibody used to treat lupus. How many medicines do you think are FDA approved to treat lupus? 1. Let's make this interactive, guys. How many do you think there are? 3? 2? All right, you guys, good. Low balling. Okay. Which ones do you think are FDA approved? Okay, everyone's got Benlysta. What else? Plaquenil. All right. 50 plus year difference between. Yeah. So aspirin was approved for lupus. You're probably not getting aspirin for your lupus because we don't give it anymore like that. You might be getting it for other reasons, but it used to be used to treat lupus, 1948. In the 1950s, they approved steroids for lupus. And then in 1955, hydroxychloroquine. And then 56 years later, belimumab or Benlysta was FDA approved. That's all we got. Yeah, it's pretty bad. So we'll talk about at least Plaquenil and Benlysta and steroids, and we'll see where we can go from there. So Plaquenil. Plaquenil is a great medication as long as you can tolerate it. It can take 6 to 12 weeks to kick in, and a lot of my patients will say, I don't get what it's doing. It didn't make a difference for me. Generally speaking, the thought with Plaquenil is, A, it's mild, B, it doesn't lower your immune system, C, it reduces flares, it reduces hospitalizations, it reduces mortality, so death, and that has been found in research, so we are not just saying it, it's actually been shown to do these things. And then some super added benefits, antiplatelet, so it's not a blood thinner, but it does have this added benefit in people who might have antiphospholipid syndrome. And then cholesterol lowering effects. It is not used to treat your cholesterol, but it does have that added benefit to it. In general, there's no serious toxicity. So if you're started on Plaquenil, we don't say you need to get your blood test done every 2 months, every 4 weeks. Yes, we do still get it, but that's to check your lupus disease activity. And then it can be used in pregnancy and lactation as well. Now, it is not necessarily categorized as safe to take in pregnancy, but we have had many studies that have shown that it is safe to take in pregnancy. And I'll kind of touch on some of the stuff with research that's very limiting in lupus. So never stop Plaquenil unless you had some sort of a problem. So never stop it unless you had a problem. This is a busy slide. I'm not going to belabor you with the information, but essentially the American Academy of Ophthalmology said that if you're on Plaquenil, what we need to do for you is get your eyes checked at baseline. So when you first start it, within 6 months to a year of starting it. And then after that, no need for eye exams for 5 years. And then you get your eyes checked every 1 to 2 years after that. That's what the American Academy of Ophthalmology recommends. And the reason for that is because Plaquenil can cause you to have retinal toxicity. But the risks up to 5 years is less than 1%. After being on Plaquenil for up to 10 years, it's less than 2%. So in your first 10 years of being on Plaquenil, you have a very low chance of having eye problems. I know some people here that have been on Plaquenil for a very long time, 20 plus years, and have had no issues. So after 20 years, it says it could be up to 20%. Up to, it's not almost, it's up to 20%. But truly, if you're getting, I mean, for me, so a lot of our docs actually will say, get your eyes checked now, we're starting you on the Plaquenil. Get your eyes checked every single year after that. We don't even follow these guidelines. We get it done every year, no matter what. That's why we say it, because now there are so many advances in getting your eyes checked that they can actually do a scan, detect it before it even affects your vision. So get it checked every year if you're on Plaquenil. Steroids. How many have experienced the horrible side effects of steroids? So they're great because they're anti-inflammatory. They're great because they suppress your immune system, because that's what we need with lupus when it's active. We need your immune system to be lowered, because what happens is, just imagine this chaos going on that's causing all the pain and all the swelling, and who knows what else it's causing in your body. And then we calm it down by giving steroids. So it's almost like we reset your immune system, right? But then it causes all this other stuff. It causes you to eat a lot, to be angry, to get kind of aggressive sometimes. I've had spouses say, I can't handle them when they're on steroids. So there are a lot of side effects. In addition to those things, it can cause acne. It can affect your libido, so your ability to want or even have sex. it can increase your body hair. It can decrease your body hair. It can cause weight gain. It can cause you to have osteoporosis, fractures, weakness in your muscles. It can mess with your eyes. It can cause cataracts, glaucoma, mood problems, difficulty sleeping, high blood pressure, high blood sugars, a lot of side effects. I think I might have took them all. Okay, so osteonecrosis is another one. So losing blood supply to a bone. I've had patients that have had osteonecrosis or avascular necrosis affecting your bone. And that can be very debilitating. You're young, you've been on steroids all these years, and now you've lost blood supply to a portion of your knee, and you need a knee replacement or a hip replacement. I've had shoulder replacements on it. So even though steroids were FDA approved back in the 1950s for lupus, we really don't want to put you on steroids long term. That's why we have all this other stuff, and yet only one FDA approved thing. So all this other stuff that we use to treat, and I'll talk to you a little bit more about those other things, but steroids in summary should be used only as a crutch in lupus. It should be used as kind of a bridge to therapy. So maybe you're adding something else on and we need to put you on steroids to calm down this flare, or every now and then you need to get steroids to calm down your flare. So it's not for long-term use. And then if for whatever reason you are on steroids, okay, so if you're on prednisone more than 20 milligrams a day, or even not, even if it's a lower dose, make sure you're taking calcium and vitamin D. If you're on more than 20 milligrams a day, you might need to be on an antibiotic to actually protect you from certain infections that are at a higher risk when you're on high doses of steroids. Even though I said all these bad things about steroids, never stop them without talking to your medical provider, okay? The goal though, despite all of this, is to minimize your steroid dosing. I have patients that have been on steroids for years. I cannot for the life of me take them off their prednisone. I've tried and I've tried. They flare, something happens, the kidney function worsens. Someone that's on 1 milligram a day still can't get her off, just trying so hard. It happens. Okay? We understand that some people need it, but at the bare minimum dose, okay? So I talked a little bit about bone health. A patient who's on steroids is 5 times more likely to fracture from osteoporosis. So if you are on steroids, talk to your provider about getting a bone density scan to evaluate for osteoporosis. And these are all of the off-label medications that are used to treat lupus. These might seem very familiar to some of you. So mycophenolate or Cellcept, also known as Myfortic, is not FDA approved, but used a lot in lupus. So is Imuran or azathioprine. Methotrexate we use frequently. It's also called Otrexup. It can be a pill, it can be an injection. Cyclophosphamide is Cytoxan. Cyclosporin, tacrolimus. Less familiar things might be tofacitinib or Xeljanz, baricitinib or Olumiant, Rituxan, Orencia, Actemra. All of these medicines we use in some way or another, what we say off-label because it's not FDA approved, to treat lupus. So that's why no two patients are the same. That really confusing slide that I showed you at the beginning, everyone has different parts of their body where the lupus is actually more active. And so that's why we kind of have to figure out what target we need to attack in order to treat your lupus. So these next few slides are, I'm going to try to rush through them because I want you guys to be able to ask questions. But this is kind of what's going on in research with lupus. I've had patients with that are on Benlysta ask me, so people that did their homework, they told me that Benlysta doesn't work as well if you're Black. Has anybody heard that before? Didn't work for you, okay. So if you haven't heard it before, so the first few studies that came out that were the big studies on Benlysta showed that, well, it worked really well in our group, but in our Black population, it didn't work as well. So this is a long-term safety, well, this actually, I'll go to the next one, is that one, but let me actually go forward first and show you this one. So this is the Embrace study. This is a little bit newer. It was published last year, presented as an abstract, that essentially showed that in patient, and the basis of this was the first couple of studies that were done that were really big that showed Benlysta is great, that then said Benlysta doesn't work as well if you're Black. It only showed something like 2% of the actual study being Black patients. So it was very poorly representative of a Black population. So this is kind of a problem we have with research, is I mentioned to you earlier that the more severe forms of lupus and the prevalence of lupus is more in ethnic minorities. That would be Hispanic, Black, Asian. There are others, I'm just kind of generalizing, okay? So if it's more common and more severe, then what the studies aren't really representing the right group necessarily, right? So what they tried to do here in the EMBRACE study was show, they just did this study in Black patients. It's the EMBRACE study. About 450 Black patients with SLE. They got monthly IV Benlysta, and they found that there were similar adverse events in each group. So if they got the drug versus the sugar pill or the IV glucose, and it was beneficial in people who had high disease activity. So basically, if your lupus was pretty active, it worked well for you. If not so active, it didn't work as well for you. Remember, these studies don't apply to everyone. You mentioned it didn't work for you, right? But that doesn't apply to everyone, right? But that's something that's at least promising, that the first couple of studies that said it's not really working very well if you're Black, that may not have been truly a representative sample. And then just going back, sorry, I went backwards here, but this is a phase 3 study extension of the original Benlysta studies that looked at long-term. So a lot of my patients will say, how long do I have to be on Benlysta for? I don't want to be on this for the rest of my life. So this is looking at 8 years. I have patients that have been on it since it first came out, actually since even before it was FDA approved. So this is an 8-year study that showed that there was minimal organ damage progression. So their lupus stayed stable. They had minimal complications and they did well. But again, I was pointing out, look at the sample, 2% Blacks. They had a larger representation of Native Americans, Asians, and whites, but not the best sampling. So I bring this up just because when we look at research and we look at FDA approval and we look at things, it's not always the most helpful. So a lot of times we have to look at each individual patient and be like, well, let's try this on you. This might not be exactly what we're seeing in the literature, but the only way we'll know is if we try. Okay, moving forward. Ustekinumab, this is Stelara. It's a medicine that's used to treat psoriasis, psoriatic arthritis. It's being looked at as a new mechanism of action for potential treatment in lupus. Looked at about 100 patients with active lupus, and they found that it was beneficial in skin and joint disease. That's all I'm going to say. I don't want to talk a lot about these. I just want to point them out. Stelara, it might help. Anifrolumab is a medicine that has been looked at for several years. I went to a conference 5 years ago, and they were talking about it then. They're still talking about it. Has not achieved FDA approval, has not achieved the benefits that we were hoping for. But it is something that has shown that patients with lupus that got anifrolumab, they needed less steroids, they had less skin disease. It didn't really affect their flares or joint disease though. So they're still working on it. Benefit of this is there are some people like with Benlysta, I tell my patients, if you have kidney disease, I'm not going to put you on Benlysta unless I'm treating that with something else and giving you Benlysta for something else, okay? So Benlysta is only approved for people who have mild to moderately active lupus. So skin and joints, fatigue. So that's kind of what it's approved for. That's what it's shown the most benefit for in the original studies. Baricitinib is being looked at in lupus. It's FDA approved for rheumatoid arthritis. So there is a study that's looking at baricitinib for lupus. And again, non-organ threatening, so skin and joints. This is what a lot of the studies are doing. They're looking at more skin and joint disease. Tofacitinib is Xeljanz, same concept as baricitinib. They're looking at it for patients with mild to moderate disease activity. Has anybody heard of a vaccine for lupus? Yeah. So they're working on this. I thought it was really interesting. It's not to prevent lupus, but it's an intramuscular injection that they're trying to, complicated slide, but essentially what they're doing is it's an intramuscular injection. What they're doing is kind of like the flu shot. They give you a little bit of the virus that triggers your body to make antibodies against it. So it's giving you a little bit of interferon, which is the chemical in your body that is believed to be high when you have lupus. Give you a little bit of interferon so that you can make antibodies against the interferon. So that's what they're trying to do. In this, it has achieved fast track status. So that basically means the FDA is saying, hey guys, if you can show us that this works, we're willing to expedite it for you. It's been in that status for a couple of years now though, but this is how research works. So just so you know, it's something that's out there. I will not discuss these in detail. These are other drugs that are in the pipeline. but things that are active, that are recruiting, that are ongoing. Lupazor is another medicine that's subcutaneous, also has fast track designation, and they're looking at a different aspect of the body. So Benlysta acts on B cells, and Lupazor acts on T cells. So again, the complexity of where lupus is active and where the disease is what targets we need for our medications. This has fast track designation as well, so they're saying the same thing. If you guys can show us sustained improvement, safety, and efficacy that is helping our patients, then we're willing to expedite this for FDA approval. Still working on it. And this is that slide. I won't talk to you about it, but I have actually covered things that act on all of these. Stelara, Xeljanz, Olumiant. This is the interferon stuff I was talking about. Here's Lupazor. So we've got multiple areas, and they act on the T cell, the B cell. Benlysta acts around here. You've got your B cell receptors. So there's a lot of places to attack when you have lupus. So that's why no two people are the same. One rheumatologist might prescribe you one thing, another one might prescribe you another thing. There's no right answer. So just barely in enough time. So summary, not all ANA is lupus, but if you've got it, if you've got lupus, then 99% of you will probably have an ANA. Never stop steroids without discussing with your doctor. Never stop Plaquenil if you're on Plaquenil. Don't smoke. Please exercise and consider mind-body techniques, which will bridge us over to our next speaker. All right, open for questions. Get started, sure. Yeah. Is there a recommended window tint? Oh, you know what? Patients have asked me this before to protect against UVA or UVB, and I've been meaning to find out, so I don't know. I'm going to keep this. If there's, oh, sorry. Is there a recommended window tint that blocks UVA and UVB? Does anyone know this? Yeah. That's the company, right? Yeah. That's the company. What types of UV? Okay, so I don't know if you heard it, but the company's name is 3M. They make the best window tint, and it says UVA, UVB.
It's all subjective, but when you go to get your tint done, you can ask them. And for example, the top layer, crystal something or other for 3M, it lowers the temperature inside of the car. It's like guaranteed to keep the temperature at a certain, it won't go over a certain temperature, and it'll block. They claim that it blocks about 100% of UV. I don't know how accurate that is,
Sure.
But it is expensive.
Okay, it's good to know. Yeah, that's good to know. Thank you. So I've actually written letters for multiple patients, basically saying, hey, this patient's got a medical condition that needs tinted windows, and I don't think that's unreasonable to ask of your rheumatologist or primary care doc. Yeah. Yeah. Right. Right. You can't. Yeah. And wow. Alta MD Skincare. That's a sunscreen. Alta, ELTA, sunscreen. Yeah. And I remember actually that Neutrogena makes a UVA, UVB titanium-based sunscreen. And then they have some, I mean, this isn't as strong, but there are some people that are saying, I hate putting sunscreen on my face. There are actually some sunscreen powders too that you can put your thick sunscreen on and then put a UV powder over it. Yeah, so that's something that you can use. Yeah. That's what we got the pills for, and in your diet. Can something as small as a paper cut or accidentally biting my cheek cause my immune system to kick into overdrive and fix things that aren't broken? Same with fighting a virus. Fix things that aren't broken. Sorry, I didn't understand that. I don't follow. So if you're biting your cheek, your immune system is kicking into overdrive, and how's it fixing things? You mean like messing things up? You mean messing things? Okay, sorry. Got it. Sorry, I took it literally. I got that. It can, because anything is possible. Anything is possible. Like I said earlier, anything can be lupus, but not everything is. So it's just knowing that difference. So if you bit your cheek and you bit your cheek real hard and then you started feeling achy and horrible for several days after that, then it might be. It's hard to say. Okay, it's hard to say. Fatigue is my most debilitating symptom. Other than vitamin D, what medications help cure fatigue? What else can treat exhaustion? I have great sleep. It's not that, but I'm always tired. So my question to you is, have you had a sleep study? Because sleep apnea you might sleep for 10, 12, 14 hours, have great sleep, but you're always tired. So making sure, so there's no medicine to treat everything. And there's definitely no medicine to treat fatigue. I've had some patients that are on Adderall for fatigue, and that some people might actually truly need that. But ideally, finding a root to the fatigue and making lifestyle changes. And I'm not saying go exercise, start eating all organic, everything fixes everything, but taking small steps to make lifestyle changes can truly help. Because again, the easiest and the worst thing we can do is say it's all your lupus. Most of the time, it's not just your lupus. There's something else causing your fatigue. Okay, why do you have to stay on Plaquenil if the side effects are so high for your eyes to have problems? What does it actually do? Good question, because I don't know the answer to the second part of it. So Plaquenil does act at a cellular level. So it acts on your T cells. It actually interferes. So in that complicated picture, so I can't actually explain it medically. In that complicated picture, it goes beyond the B cell and the T cell, and it goes at the root of the cell. So you have B cells and T cells, they interact with each other. You have this whole pathway where you're getting antibodies producing. So at the level far down at the tissue level, Plaquenil acts and interferes with the cells that are causing you to have that tissue damage. Okay, that's the simplest way of saying it. If you have glaucoma, no, it should not affect glaucoma, because glaucoma means you have high pressure in your eyes. Plaquenil does not cause glaucoma, but it causes retinal problems. Now, there are some patients I have who have underlying eye problems. So maybe they have some other eye disease. So for example, I have a patient who at birth, she had a problem with one of her retinas. So because of that, we couldn't put her on Plaquenil because we already couldn't look into the back of her eye. So we weren't able to actually know if the Plaquenil were to cause damage, where is it causing? We wouldn't be able to know. So we never put her on Plaquenil. But in general, so the risks of the reason I showed you those percentages were actually to show you that the risks are actually so low. So that up to 20% risk is after being on it for a long time. And that too, it's not 20%, it's up to 20%. Again, remember with research, looking at what population you're looking at. If you have diabetes, you already have a higher risk of having retinal disease. You got glaucoma, you already have a risk of having retinal disease. So you have other risk factors. Obesity puts you at higher risk. If you have a history of breast cancer, you've been on certain breast cancer treatments, you have a higher risk of retinal disease. So there are a lot of things that can affect your retina that's not from the Plaquenil. So that's why we kind of look at it in general as overall, big picture. No two people are the same, but big picture Plaquenil is generally considered safe enough to say if you're pregnant, you could take it. If you're breastfeeding, you could take it. And that's because it's actually been shown across the board that it doesn't cause side effects. across the board. So there are always going to be rare situations where it might, but in general. What are the major side effects of Plaquenil? What percentage of patients tolerate it well? So I think I kind of touched on this. I will say the majority of my patients tolerate it well, but I have had patients have a reaction to it. Skin rash, upset stomach. So kind of things that I had already talked about. What does lupus remission really mean? Will ANA ever return to normal? So I never retest an ANA unless the lab forces me to because it's a panel. I don't retest an ANA once I know somebody's got a positive ANA because that titer does not, one time if it's positive it helps, but we don't follow that titer. It's not helpful to follow it. You know you have lupus, that ANA is not something that's going to increase or decrease based on your disease activity. That's why I was saying only the C3, C4, the double-stranded DNA. Those are the three like lupus specific things that we look at. The C3 and C4 can be affected by other things too, but when it's low, that's when we're looking at lupus. When the double-stranded DNA is high, we're looking at lupus. So the ANA is not something that we follow. Lupus remission can mean many things. It could be that I have no more symptoms, my blood tests look fine, so your lupus is in remission. It could be that at one point you had kidney disease and you've now done so well, you are doing fine. I've had patients that we were able to get off of all meds and they're on nothing, and I just see them every 6 months, make sure they're still doing okay, but they've been in a bad place before. So there are people who do go into remission. Does everybody? No, but we do still recommend stay on your Plaquenil if you can. Low complements, what is the significance of C3 and C4? I think I talked about this already. Can these proteins be supplemented? No, they cannot, not yet. Would this help with the symptoms? So no, can't be supplemented, but your C3 and C4 are low because when your lupus is active, all of the immune complexes that are forming in your body, they cause this reaction in your body that eats up the complements. So it makes your C3 and C4 drop down. Can my children get the lupus vaccine since I have it? Lupus vaccine is not FDA approved, so no. I have no idea. But that vaccine is actually being used to treat people who have lupus for now. So maybe in the future. That's a really good question though. When or how do I get tested for cancer? So cancer testing is something that you got to see a primary care doc for, and it's age appropriate. So if you are of the age to get a mammogram, get it. If you're of the age to get a pap smear, a colonoscopy, all of those things, get them. If you have a family history, you better start talking to your primary care doctor early because you've already got a family history, so you should be getting screened anyway, irrespective of the lupus. When was lupus first discovered? Holy guacamole, guys. That's messed up. I don't remember. Oh, I can answer that one. Yeah. How long before that? You know what? Now, let me keep this one aside. So, yeah. So I'll share a quick story on this because I keep harping on Plaquenil. Do you want to know how Plaquenil was actually even discovered to be used in lupus? Because everyone's always saying, we don't really know how Plaquenil works, right? So, because of the wolves? No. No, actually, so in World War II, the veterans the soldiers that were fighting, they were getting Plaquenil for malaria. They were being given antimalarial treatment. Later, they found that those soldiers who had joint pain and skin rashes, later diagnosed with lupus, actually had complete resolution of their symptoms, or at least near complete resolution of their symptoms. That's actually how Plaquenil actually it got discovered as a lupus med and then FDA approved. But since then, FDA regulations for approval regulations are just so complicated now that it's almost unethical in some cases to get FDA approval. So that's why all of those other meds I listed, the Cellcept, Cytoxan, all of those, they're not FDA approved because we can't really do a trial that's like, here you go, here's some Cytoxan and here's placebo. We're not going to give you the sugar pill to see if it helps you. So it's just that's a really simplistic example, but that's why it's so complicated. Thank you for the compliment. How can you take care of hair when it gets so rough, dry, and clumps up during the shower? Use a lot of conditioner. a lot of conditioner. I go through major conditioner bottles, but conditioner is really big. That's all I would say as far as clumps. If you have alopecia and you lose a lot of hair, then I do recommend seeing a dermatologist. Some rheumatologists actually prescribe meds. I give my patients certain shampoos sometimes. If you have alopecia, I sometimes will do Olux shampoo. I'm running out of time, huh? Why is discoid lupus incurable? Can it be reversed? The problem with discoid lupus is it's a scarring disease. So once you've got it, it's really hard to get rid of it. So it does scar. So that's the difficulty with that. And I know you had mentioned that you've been on Benlysta before. I have some patients that have done really well with discoid lupus on Benlysta, but then other patients that don't. Perfect. And there's actually, I didn't bring this up, but there are some folks, and it's in the literature, I've done it too, where we do like a Rituxan load. So we give you Rituxan, and then we follow through with Benlysta monthly after that, just as like a maintenance. Remember, I'm of the thought that rheumatology is a lot of cowboys and cowgirls, kind of just, we know this stuff works in some cases, so we're going to try this on you. Not that you're a guinea pig, but truly that it's such a complex disease that no two people will be managed the same way. So. Right, and Rituxan's a good option. Okay, all right. Can lupus cause epilepsy? Yes. Seizures. It can cause seizure disorder. So yes, lupus can. When it affects the brain, it certainly can. I didn't see my steroid up there. I get Kenalog injections every 3 months. Been on it for 15 years. Is that okay to continue? Kenalog is a steroid. It's triamcinolone. So Kenalog as an injection every 3 months is essentially, so that's like being on steroids. So long-term, less than ideal. If you could be on something, and remember, I'm not your rheumatologist, so my job here is not to give you medical advice, just education, right? The recommendation is to be on the bare minimum steroid. If you can be on a lower dose, if you can be off of it, that would be ideal. And what we like to think of is all these other meds I'm talking about, these are called steroid-sparing therapies. So they're basically medicines that help us help you get off of steroids. That's the purpose of them. Yeah. It's like prolonged, low, steady level of steroids. I can tell you, yeah, so I can tell you that when I have a patient I have to put on steroids, my preference is the injection, but I don't prefer to do it every 3 months just because it's still like taking it. It's still long-term steroid. But if that works for you and that's something that you've discussed with your rheumatologist, as long as you're aware of those risks and you're asking for osteoporosis evaluation and being on your calcium and vitamin D, it's good. But just think of it as you are on long-term steroids. Okay. If lupus is unknown, how are rats or mice given it for tests? You mean if yeah. Do I have some animal lovers here? Research is really complicated, but yes, mice can be given lupus because they have found some genes that can actually, so basically the common genes that we know in lupus, or the interferon signature, which we know is very high. So interferon alpha is high in a lot of lupus patients. So they can actually trigger that in mice. And by doing that, they then do studies to see if some of the meds work on them. It's unfortunately, right? So unfortunate because of animal treatments, but fortunate because of what it allows us to produce from a drug research standpoint and meds for our patients. It has allowed for all of the advances that we have today, with the exception of black lung. Yeah. What do you mean given? Right. Yeah, so that's actually what the basis is for all research though. So an example, just one example would be, they're giving these mice interferon alpha. They're increasing their interferon alpha levels in their body and triggering lupus that way. And so because of that kind of mouse model, there are a bunch of different mouse models. Because of that specific mouse model, they're able to translate that over because they have found in humans, first they found in humans that their interferon alpha levels were high when they had lupus. So they tested it out to find if they were able to reproduce certain manifestations of lupus in mice. So by doing that, they're able to, as much as possible, reproduce lupus in a mouse and then test these drugs on those mice to see if it works in them, and then go in from that phase of the research into a phase 1, phase 2, phase 3 research study to test all of these meds that we're using for lupus. So it does actually start in that mouse model to help us further understand where lupus comes from. But all of that complexity is how we were able to even make that weird picture I showed you. That's how we're able to get that information. How are some people diagnosed with lupus that have a negative ANA at times? So chances are you probably had a positive ANA at some point. And that's why I say don't retest, because it's not super helpful. 1% of people can have a negative ANA though. Can you have too much vitamin D? Good question. I have had this question asked to me multiple times, and I've asked the same question over. I'm yet to find somebody with vitamin D toxicity, but if your level's in the hundreds, that means you probably don't need the dose that you're on. But usually I would say above 40, great. Keep your levels good. But if you're in the hundreds, you probably just need to cut back. I've never seen anyone have side effects. So this is me just kind of arbitrarily saying, I mean, it's also a medicine you're putting in your body. It's a supplement, but remember, there's still pills. So if you're able to supplement enough of this stuff in your natural diet, that would be more ideal, right? The pills aren't going to be everything. Is leaky gut real? I know someone who's going to be talking about that, so I'll leave this one for you. You're going to be talking about it. Okay. Are people with lupus more easily infected by viruses like Ebola or the coronavirus? I just got a picture of a zombie sent to me earlier today. So if your immune system is offset, then yes, you are at a higher risk, but not of developing it. It's more that if you're exposed to somebody who has it, then your immune system may not be as effective in, fighting it. Okay, everyone, thank you very much. I hope I answered as many questions as I could. I got through all of them except leaky gut. Thank you very much. No problem. I'll give this to Micah. You can save it for when you talk. Sorry, I should have got my stuff.
Thank you, Dr. Sandy. That was very helpful. We appreciate it. We're going to get started now with our next presentation with Dr. Du, and then after that, we will have a break. We still have the food out, so we'll leave it out all night. If you would like to get more, if you didn't get a chance, so you can bring the food in here. So please help yourself.
Hi, can everyone hear me? Okay, great. My name is Lumi Du. I am a first-year rheumatology fellow, and I work in Loma Linda University, so I'm working under one of the greatest rheumatologists, Dr. Sandu, and some of our colleagues as well that will be speaking after me. So I thank you, first of all, for inviting me to participate in this conference. I wanted to talk a little bit about mental health and wellness in lupus patients. So main thing, when people are first diagnosed with lupus, a lot of times I get blank stares. People are concerned. They don't really know what lupus is a lot of times. It's a very rare disorder. So what are we concerned about? What are some of the things that we think about when we're thinking about mental health? One thing is uncertainty of the future. First of all, what is lupus? How is this going to affect my health overall, my lifespan, societal anxiety? When I go out in public, how am I going to look? You know, the appearance of my skin, joint pains, and then also panic attacks. Some people have them. Others have anxiety and depression that worsens. Also dealing with a lot of chronic pain and fatigue. Those are some of the most common symptoms that lupus patients face. And so, you know, a lot of patients I see who have pretty good control of their joint pain or their skin issues, but they're always having that pain and fatigue that just never really goes away. Also, concern for family and friends as well. A lot of times you see women and men alike that are concerned that this will be a burden to their family members, how they're gonna kind of incorporate this to their everyday life. And also finally, financial burden, which Lupus LA and some of the organizations are very good at giving resources, but it's also, how am I gonna afford the medications? When we're switching medications, how much does that cost? You know, so all of those things play a role in mental health. Concern, stress, anxiety, it's common and it's very much expected. We know that when you have this new diagnosis, doctors know you're going to have all that stress and anxiety. Lupus affects up to 1.5 million Americans, and up to 75% of those patients have neuropsychiatric symptoms. So what does that really mean? There is a component of lupus called CNS lupus. So lupus affects, it's a systemic disease. It affects all different organs, including your kidneys, your joints, your skin. You hear about those the most. However, 75% of those patients also have CNS lupus. What that means is you can have anxiety, depression, chronic headaches. Some have seizures, psychosis, and forgetfulness, which is kind of like that mind fog that a lot of people mention. What exactly is psychosis? That means hallucinations and delusions. Up to 3% of lupus patients can have these findings. Usually it happens early on in the disease process when you're diagnosed. However, those are things to think about. So basically what that's telling me is lupus is causing this anxiety and depression. It's part of the disease process. And the theory behind it, there are some studies that are done, and like Dr. Sandhu had mentioned earlier, type 1 interferons, which are pretty much proteins in the body, can actually trigger inflammation, a cascade of inflammation. And they've done mice studies that actually show increased interferons that travel from the blood into the brain. So initially they weren't quite sure if this blood-brain barrier, which is kind of a wall between the rest of the body and the brain, whether the inflammation crosses over to that side. However, there are some mice studies there's some studies from 2017 that showed that they were able to cross over. However, in terms of treatment medications, there aren't any that have been proven yet to really target that and help with the inflammation in the brain that may lead to anxiety and depression and some of these symptoms you see for CNS lupus. Okay, so chicken or the egg? A lot of times, you know, the big question is it lupus that causes the anxiety and depression? Or is it really just the psychological stress, which is a risk factor that can cause lupus to manifest? And so this kind of diagram, it's kind of hard to see, but it's a figure from a journal from psychiatry that goes into how psychological stress can increase risk for autoimmune disorders. What we're looking at, of course, there's infections, the genes that you have, and then your gut microbiome, which Dr. Yu will talk about, can all affect and cause autoimmune disorders. However, psychological stress, meaning anxiety and depression that you might already have, causes chronic inflammation in the body, and that can lead to psychotic disorders that eventually can lead to autoimmune disease. So to be honest, it's unclear. It can be both. They can interplay with each other, where lupus itself can cause anxiety and depression. Anxiety and depression that you already have can give you a predisposition to get lupus. Also, the other things that we need to worry about is that depression is linked to worsening lupus activity. Part of it is the thought that there is non-compliance to medications. When you have depression, when you have anxiety, when you have panic attacks, and that can lead to worsening lupus activity simply because you're not taking your medications on time. But also depression, when they did a study on lupus patients versus patients that don't have lupus, that are generally of the same age and socioeconomic status, you have a higher risk for cardiovascular disease for lupus patients that have depression versus those that have depression and don't have lupus. So there's definitely a a clear link or correlation between mental health and lupus. Mental health and wellness is very much multifactorial. So in order to have this wellness or perfect balance, you need to have all these areas that are balanced and well managed, or you have a support system. So there's 8 dimensions of wellness. This is in some studies and reports of emotional health, financial health, social, spiritual, occupational, physical, intellectual, and environmental. So I just wanted to address some of the areas here that contribute to overall mental health and wellness for lupus patients, and the resources that we have, some studies, things like that. So physical health, exercise and diet; emotional health, how we can deal with anxiety and depression; financial, and sleep. Okay, so one thing I always want to tell my patients is to own your health journey, to try to learn as much as you can about lupus. You guys are already doing a great job by coming to this conference. Some good reputable resources to look for information is Lupus LA online or Lupus Foundation of America, kind of going through the information, looking over it to really see what are the facts that I don't really know about lupus, what kind of questions can I ask my rheumatologist. Also being accountable and consistent with your appointments and treatments. Being able to know when your next appointment is, what your treatments are, that is very much helpful, because then you know what the next step is, or the thought process of why your doctor is doing the certain medications. Also be aware of your symptoms. So always ask your rheumatologist in these appointments, what kind of symptoms should I be looking out for? What kind of side effects to medications I should be looking out for? And really write them down, bring a list of questions. It's always very helpful when I have patients come in that already have a set list of things to ask, so we can kind of go through them. And then the main thing is, this is a team effort. So that means that not only the rheumatologist, but you have primary care doctors, you have other specialists that are seeing you, and they all interact. So you really need to inform your other doctors as well about new medications, supplements, and treatments that you'll be getting, so that we can know whether any of them interact or how to monitor them. And then once again, mandatory to make this team effort. So education with the treatment team has actually been shown to improve mental health and fatigue in lupus patients. There was a nursing study done back in 2004. They had about 122 patients and asked them to have either their spouse or a caregiver to also participate, and then they would, in the course of 6 months, get education as well as monthly phone calls. And they found that the ones that participated in this versus the ones that didn't, there was a big difference in improvement in mental health and fatigue. So trying to be as informed and participating and asking questions is very important. Joining official organizations, there's online support groups, social media. I think we're getting information about like Facebook groups, and I'm sure some of you are part of those as well. So those will be helpful for asking questions. However, I would like to say that once you get the information from there, it's always nice to verify it with your rheumatologist as well. And then finally, I think referral to mental health. So I think that's important to do it even early on, because throughout the process, lupus is a lifelong disease. There is clinical remission, but you'll be dealing with it. And so talking to mental health is a very good option. Asking for a referral from your rheumatologist or your primary care doctor is recommended. And it doesn't have to be medications. There are treatments that you can do, like cognitive behavioral therapy, biofeedback, things like that, that I can touch on briefly. And also just speaking with like a psychologist or psychotherapist can be very helpful too. Financial concerns, speaking with social workers about insurance, there's benefits.gov, some resources online. And then you guys will also be receiving a copy of this, of all the slides from this as well. So you can refer to them later. Okay, so in terms of mental health, exercise is very important and it improves quality of life. There's been meta-analysis studies back in 2017. Basically meaning, meta-analysis means they have a group of multiple different trials looking at the same effects of exercise and association with lupus, and try to find things that are similar that have shown efficacy. And basically, for lupus patients with at least 20 minutes of exercise for 3 days a week, for up to 8 to 12 weeks, had showed improvement in fatigue, okay, which is the most common symptom of lupus. However, it doesn't necessarily decrease lupus disease activity, meaning like blood levels. When you look at double-stranded DNA, complement levels, it's not necessarily going to make a change in that. However, the idea of moving and decreasing fatigue and stress, those things which influence lupus, that can be very helpful. Also, however, even though the studies were limited to 20 minutes for about 3 days a week, it is recommended to do ideally daily for at least 30 minutes to an hour. Some exercises that are recommended that are also part of complementary and alternative medicine are like yoga, Tai Chi, brisk walking, and stretching. Stretching is also very important. So anything that you can handle, you don't have to do 30 minutes to an hour. Start off with something small that you can commit to every day, and then just gradually go up on it. And we can always kind of talk about that a little bit more. Eating healthy. So I'll just talk about this briefly since Dr. Yu will be talking on that a little bit more. But there is no clear lupus diet. There's always books that come out that say, you know, there's a set lupus diet regimen about what medications or what foods to avoid, that kind of thing. However, there are some things that we generally recommend. Decreasing alcohol consumption, because some of these medications we give you, like for example, methotrexate, can affect your liver. And so you don't want to be consuming alcohol if possible. Avoiding alfalfa sprouts and garlic. There's some older studies that say it's pro-inflammatory. So if you can avoid it, great, but garlic, a lot of people use garlic, so you know, just watch how much you take. The other things though is more like omega-3 fatty acids and vitamin D. There are some high quality randomized control trials that have been done, and it shows that omega-3 fatty acids can actually decrease disease activity. That means there are some official disease activity scores that people do that rheumatologists refer to, and there's actual decrease in those levels from omega-3 fatty acids and vitamin D. The study did use these supplements, which is 540 milligrams and 360 milligrams of DHA and EPA, which are just different forms of omega-3. And so that's kind of what the study has gone off of, but the range can be from 250 to 1,000 milligrams of omega-3 fatty acid, pretty much what is available over the counter. And then vitamin D, like we mentioned before, it can cause vitamin D deficiency, can lead to lupus as well. So vitamin D supplementation is recommended. And in the studies that were done in 2016, where they looked at lifestyle habits though, when they looked specifically at low calorie or low sugar diets or low fat diets, there's decrease in fatigue, decrease in weight, but not necessarily decrease in lupus disease activity. So that is something to kind of think about in terms of, you know, decreasing calories and sugar. Those can be beneficial in the long run, but just take note that it doesn't necessarily affect the blood levels. Sleeping well is always important. 67% of lupus patients have poor sleep in comparison to their controls. Controls mean anybody that is around the same age group, same gender, socioeconomic status, they kind of compare them, and there's decreased sleep in lupus patients. Most likely it's this vicious cycle of you're having fatigue and chronic pain, concerns, and that causes lack of sleep, and then the lack of sleep causes fatigue and pain. So good sleep hygiene always is important. I'm sure you've heard of all these things already, but turning off all of your electronics 30 minutes before sleeping, not to drink any water right before going to bed, because then you'll be waking up in the middle of the night going to the bathroom. Not trying to exercise up to 2 to 3 hours before going to sleep, because that'll usually kind of increase, kind of make you feel more awake. and trying to take away TV or any electronic devices inside the bedroom. That'll be distracting as well. Cool temperature and quiet room for sleep is encouraged. Now, 65 degrees is what's recommended for the general population. However, I know for our lupus patients, a lot of times they can't tolerate the cold very well. Some people have Raynaud's symptoms. So you don't necessarily have to do that. Whatever is comfortable for you and a quiet environment that promotes sleep is encouraged. And then try to set the same time of night to go to bed every single night if possible. That kind of rhythm works with your circadian rhythm, and overall it'll help with good sleep hygiene. Now, if you continue to have sleep difficulty, you've tried all these things and you've already seen your rheumatologist and your lupus activity is being controlled with the medications, but you're still having issues, then you want to get a consultation for a sleep study, and that is highly encouraged to see if you have obstructive sleep apnea, obesity, hypoventilation syndrome, restless leg syndrome. There's a lot of factors that go into it. So you want to rule that out first before we do anything else. Okay, so complementary and alternative medicine. Just by a show of hands, can you guys raise your hand if you've ever tried acupuncture, chiropractic medicine, massage therapy, any of those things? Okay, so a good amount of people. And over 50% of lupus patients have utilized complementary alternative medicine. And I'm not surprised by that, because even with good disease activity, you're going to have that fatigue and pain. So just to let you know, there are some studies that show some benefit with supplements, and I will briefly touch on that. However, there isn't enough evidence to say you can just use the complementary alternative medicine and that'll help with your lupus. It's complementary to what we recommend for your lupus treatments with the medications that we provide. However, overall, this can help with fatigue and pain. Some of the ones that we often prescribe or refer are acupuncture, also Reiki therapy, which is kind of the thought process that there is a life force and that if you touch certain areas of your body, that can decrease pain. And so some patients say they actually have decreased pain with that. Cognitive behavioral therapy, talking through the disease and pain processes and working through it with a psychologist or psychotherapist. And then aromatherapy, things to kind of calm you, decrease stress. A lot of people use those as well. Herbal remedies. So this is in mostly, I guess, the most popular topic these days. One of the ones that is a hot topic right now is turmeric or curcumin. And actually in Loma Linda right now, Dr. Yu and Dr. Sandhu are doing a study with our lupus patients to see whether turmeric can decrease inflammation and help with their disease activity. So I don't know if you wanted to talk on that a little later or. Mm-hmm. Yep, so you can ask about that. And also substances. I see a lot of patients nowadays using CBD or CBD oils to kind of help with joint pain. They do say it helps. There aren't enough studies yet to, give a strong recommendation and say CBD, I recommend it. However, it does seem there are several patients that say they have some benefit with the oils. Cultivating a positive mentality. So just decreasing stress overall, that's what I've been kind of emphasizing throughout this whole presentation, is decreasing stress can prevent lupus flare-ups, meditation, either by prayer, doing daily journals, or these kind of meditation guidance apps that are on your phones. Those are also encouraged as well. Getting a lot of support from family, friends, religious groups, and then also being an advocate for lupus awareness and research can also be helpful. Family support. So there is some information online for caregivers on how they can get respite care and what else they can do. But also a big question I get from caregivers or spouses is, what else can I do to help? And communication is first and foremost the most important thing. Always communicate to each other. If you come to the appointments, that's also helpful too, so you're both aware of what's going on. And then also recommended is creating a care file. Care file is pretty much like a folder of all of the information of the patient on their personal information, you know, name, date of birth, etc., what their current diagnosis is, so lupus, when they were diagnosed, where they were diagnosed, who was the doctor that diagnosed it, you know, what kind of symptoms was I having at the time, the current medications I'm on, what dose I'm taking, and what kind of reactions have I had to some of the other medications or allergies I may have, prior medications that you had taken and why it was discontinued, all of your doctor's visits, and then emergency contacts. And being aware of upcoming appointments is also helpful because then you'll know, you know, which specialist am I talking to, who is the next person that is coming up that I can kind of share this information with, and who have I not seen in a while. Also for our lupus patients that are children or teens that are diagnosed earlier, I think it's very important that they learn together, but also gain ownership or responsibility in their healthcare. So early on, as they are learning about lupus, to kind of be more aware about their medications, when they're taking them, why they're taking them, coming to the appointments and knowing why they're there for them. And then for parents or family to inform school nurses, counselors, teachers about the diagnosis so that there's other eyes that are watching out for the patient. And then always having good communication with the healthcare providers as well is essential. These are some resources. So websites, lupusla.org, and then National Center for Complementary and Integrative Health is another one that I would recommend, especially since that is gaining some popularity also with like mental health and fatigue. These are just some books that are online that you could look at, not necessarily like guidelines or anything, but just some tips to kind of read about other people's perspectives on dealing with lupus. And then a lot of applications online that are helpful. So for meditation, there is the Calm application, Insight, Headspace, and then for sleep, there's Pillow and Sleep Cycle. For herbs, so if you're looking into trying different supplementation, there's a good one called Herb List that's free. And you can look at herb and drug interactions. That's very important when you are about to start any herbal supplements because they can interact with how your drugs work. Sometimes it can make your drugs stay in your bloodstream a lot longer, and so that can be more harmful in the long run. And then for any community or service groups, dialing 211 is very helpful as well. It's available in all 50 states, and you can ask about, you know, financial issues or certain questions and resources or people to reach out to. And then down here is more for our younger population. If there's scholarships that are available for students or even high school, college students that have patients with lupus that need assistance, or patients under 25 years old that have been dealing with lupus or just diagnosed with lupus within the past 5 years. Those are some resources as well. So another thing is, I think this will be a good thing to kind of take away from is when you have some time later, just start asking yourself some questions on how much do I know about lupus? What am I really unsure about? And try to look through information on your own and also ask questions. And then who can I ask for help? Who really is in my support system? Who is stressing me out? And what's one step I can take towards decreasing the stress? If there's anything else that us as rheumatologists can help out with, just reach out to us. Always take it one step at a time, communicate, and make sure to take action and ask more questions. Okay, so that's it. Thank you very much. Oh. Oh, yeah. It's just, okay. All right. Oh, sorry. So we just have one question. Is there a time limit for CNS lupus diagnosis? If there's a major recurring depressive disorder was diagnosed at the same time as lupus, are odds good that CNS lupus is there if the patient also has chronic migraines, neurologic issues, etc.? So time limit for CNS lupus diagnosis. So it does present itself more earlier in the disease process, but I would say that it could happen anytime throughout your lupus disease process. So anytime that you have worsening disease activity or flares, that's when you want to worry about, okay, you know, some people pop up and the first thing is they have a seizure all of a sudden. And it doesn't seem to happen right when they're diagnosed, like within the first year. It can happen at any time. Or your depression is getting worse. Those are some things to think about, and you can always ask, you know, do you think I have CNS lupus, to your rheumatologist as well. If I have major recurring depressive disorder that's diagnosed at the same time as lupus, is there good odds that CNS lupus is there? I would say that's a good question. I think I don't have a clear answer to that, but I would say that more likely than not, it's higher on the differential for you than somebody who doesn't have depressive disorder and just has lupus, or the other way around. But definitely, if you're having chronic migraines or headaches, if you're having other neurologic issues, trouble with sleep, anxiety, depression, and you find that when you're having your lupus flares or you're having joint pain and it seems to be getting worse, that is something to think about. You have a higher chance of being diagnosed with CNS lupus. Okay. All right. Thank you.
Dude, that was great. We're going to take a short, quick 5-minute break, and then we'll get started. Hello, everyone. Welcome back. We are going to get started now with our next presentation with Dr. Yu.
Hello. Oh. Okay, can everyone hear me? Louder? Okay. All right, I'll speak louder. Okay. So my name's Dr. Yu, and I am also board certified in lifestyle medicine, as well as a rheumatology fellow. So today my topic will be on lifestyle medicine and lupus. And who here has heard of lifestyle medicine? So several of you. It's a relatively new field. It was created here at Loma Linda about 15 years ago, and it's actually exploding in the United States now. So what are objectives of today's talk? So we're going to talk about the gut microbiome. Who here has heard of the gut microbiome? Very good. Many of you. So the gut microbiome is essential to lupus and how it interacts with lupus. We're going to talk about what is lifestyle medicine. We're going to talk about how food can impact us. Talk about anti-inflammatory foods, pro-inflammatory foods, and we're going to learn about other lifestyle medicine factors that can affect lupus as well. So what drives autoimmune disease? Dr. Sandro has already talked about this earlier, but it's your genetics and environment. If you cannot have lupus without the genetics, okay? They've done studies on twins. It's about 25% that can contribute to lupus. The rest of it is your environment, how you were born, How do you smoke in the past? Did you drink alcohol? Do you do drugs? How you eat? Do you exercise? That's the environment, okay? And that two together will create lupus. So what can I do for lupus? I'm sure many of you have asked, can I get off medications if I have lupus? What can I do for myself to minimize the medications? And the answer is, you can do a lot to minimize the medications for lupus. You have the power to change the course of your lupus, but you have to work at it, and that's what I'm going to talk about today. So the gut microbiome is your intestines. So there's about 100 trillion bacteria in your intestines. And those bacteria, they talk to your immune system. 60% of your immune system is at the gut. And the bacteria will talk to your brain, they talk to your liver, they talk to your heart, your arteries. And this is relatively new information in the past 2 decades that we've done research on. So it's so important that you feed your gut microbiome, which I'll be talking about more in the next couple of slides. So what impacts the gut microbiome? Your diet, the drugs you take, where you live, what age you are. As you age, your gut microbiota changes. How were you born? Were you born through a C-section or through natural or through vaginally? That can also change your gut microbiome. And your stress levels as well. And your ancestors, how they ate and how they lived will affect your gut microbiome as well. They've done study in rats over several generations, and they found that as they did one population of rats, they fed them really healthy food, a lot of fiber. The other half, they fed them high-fat foods. The group that ate purely fat foods, they lost a good bacteria over several generations. So that can be applied to us as well from our ancestors. So someone asked earlier, is the leaky gut phenomenon real? And yes, it is. We actually talk about the leaky gut in our national conferences. Before, the leaky gut phenomenon was just a myth. They talked about it in naturopathic medicine and functional medicine, but we actually talk about it in allopathic medicine now. Oh, I went. So what is the leaky gut? So let me put it this way. So when you're healthy, the cells in your gut, they're all connected to each other. So it's something called tight junctions. But when you have lupus or autoimmune disease, for example, the cells start breaking apart a little bit. So there's like a junction, and that junction is a pathway to your immune system and the rest of your body. And the bacteria, the bad bacteria and small food particles, they start going through and they start talking to our immune system in a bad way, okay? When you're healthy and you eat really healthy foods like fiber, fruits, vegetables, they also interact with the immune system. But they tell your immune system, hey, they tell your bacteria to interact with the immune system and say, calm down the body, let's calm down the inflammation, let's put it in homeostasis. But that's the opposite effect when you have lupus, okay? So, but we can fix this. We can help it by the food we eat and our exercise and our stress levels and so forth. Any questions on the leaky gut? It can be quite complicated. Functional medicine tests for leaky gut. In allopathic medicine, we don't test for the leaky gut. When you have lupus, it's assumed you have a leaky gut already. It's something called gut dysbiosis. A lot of autoimmune diseases, rheumatoid arthritis, psoriatic arthritis, and so forth, have a leaky gut, okay? Leaky gut is just another name for, scientific terms, it's called increased intestinal permeability, okay? So are you talking about inflammatory bowel disease or? So you don't have to have a inflamed gut in order to have leaky gut. A lot of people can have leaky gut. A lot of us here might have leaky gut just because of the way we eat. We don't have to have lupus or inflamed gut per se, okay? So it's at the microscopic level. It doesn't have to manifest itself as symptoms. So there's a lot of people that can be walking around with a leaky gut that don't have any symptoms. They can seem to be healthy on the outside, okay? So what drives autoimmunity? We sort of talked about this already, genetics and the stress levels, pregnancy, your gender, how you eat. So that all drives autoimmunity through the gut microbiome. So this is what we should not eat. So we shouldn't eat frosted flakes. We shouldn't eat burgers. We shouldn't eat hot dogs, French fries, Doritos, cheesecakes. Yeah, all the good stuff. You're gonna hate me by the end of this presentation. I can guarantee that. Or ice cream, everything that's good, everything that I used to love. So these things can drive gut dysbiosis, or in layman terms, imbalance of the gut microbiome. Okay, these things can drive your leaky gut, and they can drive your lupus as well. So I'll be talking about soon what we should be eating, but 1 in 5 Americans have an autoimmune disease, and the rates are only rising. I was looking at a journal in the disease of celiac disease, and they mentioned that the rates of autoimmune disease are going up by 7% a year in the whole world. That includes thyroid disease, lupus, type 1 diabetes. So that's all autoimmune disease, and it's going up, unfortunately. So with the rapid increase in autoimmune diseases, it clearly suggests that environmental factors are at play due to significant increase in those diseases. Genes do not change in such a short period of time. This is a quote from the president of the Autoimmune Disease Association, okay? Our genetics have not changed that much. It's the environment that's changing, the way food is processed, the way food's made. It's not natural. We're not eating the way our ancestors used to eat. Our ancestors did not have Doritos. They did not have burgers, okay? Way back when. So the American College of Lifestyle Medicine, as I said, it's a relatively new field, and through the American College of Lifestyle Medicine, patients have been healing, not only through autoimmune disease, but heart disease, diabetes. Diseases have been reversed, and patients have been able to get off medications. And if you're interested, I urge you to go to the website. You can just Google American College of Lifestyle Medicine. Who here has watched Forks Over Knives? It's a documentary on Netflix. Game Changers as well, it's new on Netflix. So these documentaries are aligned with American College of Lifestyle Medicine. There's a lot of science coming out now that support this. So the American College of Lifestyle Medicine focuses on 6 factors: healthful eating, mainly whole food plant-based eating, increased physical activity, stress management, your relationship with other people, how you sleep, and alcohol and drugs, okay? So the first thing I'll be talking about is nutrition. Just a show of hands, who here thinks fiber is healthy for you? And who here counts their fiber? Yeah. It's hard. So fiber is really important, but first we're going to talk about what diets are out there and which one we should be eating. So there's an autoimmune protocol diet, which I'm sure many of you have heard of. There's the carnivore diet. There's a keto diet, very, very popular now. There's a vegan diet. There is the Mediterranean diet, whole food plant-based diet, pescatarian diet, vegetarian diet. So there's all these diets out there, and we're bombarded every day by the media with so many different diets that people are on, but what should we really be eating? Okay, so I'll be talking a little bit about that. Hippocrates, many, many years ago, many centuries ago said, let food be thy medicine and medicine be thy food. And I think it can't be true, more true. And we should have food be thy medicine. Food can be healing. So fiber, that's here, if there's, right here. I don't know how many of you look at this on the back of your labels, but it's so important. Okay, so your fruits and vegetables all have fiber in it, and you should be emphasizing fruits and vegetables. Fruits and vegetables have phytonutrients. Fiber itself talks to your immune system through the gut. Fiber, when you eat it, it creates something called short-chain fatty acids. And short-chain fatty acids can calm down inflammation. T regulatory cells are very low in lupus. When you eat fiber, it increases the T regulatory cells in your gut, and that sends signals through the immune system to the rest of your body. And that's what fiber does. It's underutilized, it's undervalued, and it's the most important nutrient you should emphasize in your diet. And you should be getting about at least 30 grams of fiber a day. Okay, that's the national guidelines, depending if you're male or female. I think if you're male, it might be even higher, almost 40. Okay? So I emphasize eating the rainbow. Okay? And it's not this rainbow, it's this rainbow. Okay? So every color you see in this slide has something called phytonutrients. Who here knows about phytonutrients? Okay, very good. Some of you. So phytonutrients are nutrients, micronutrients in our foods, natural foods, that don't keep us alive, but keep us healthy. And each color has a different phytonutrient. For example, grapes have something called resveratrol. You can also find that in red wine. But I don't want to tell you to drink red wine every day. But eating grapes naturally is very healthy for you. Red color has something called lycopene in tomatoes. Oranges also has something different. They have vitamin C, and greens have something different as well. So you got to emphasize different things. They each talk to your immune system. Okay? So try to eat these at least several servings a day. It will help your lupus. In addition, broccoli is very, very good. These are just examples of different foods you can emphasize in your diet. I'm not telling you that these are the only foods you should be eating. This is from the Physicians Committee for Responsible Medicine. They're a physician group that emphasize whole food plant-based eating. They're located in the East Coast. And broccoli, they have cancer preventative foods in them, such as called glucosinolates. They also calm down inflammation. Bananas are very good. Beans are so good. They have good protein content, high fiber content as well. Artichokes, tempeh, miso soups are very good, and blueberries also. Okay? So I cannot emphasize this enough. Eat whole fruits and vegetables. Also, spices in your pantry are very powerful as well. Rosemary, oregano, cinnamon, black pepper, turmeric, which we have a study going on. These are all anti-inflammatory, and you should use them to replace salt and sugar in your diet. Vitamin D, we talked about this earlier. Studies have shown that low vitamin D levels have been correlated with increased fatigue in lupus, has been correlated with increased pain in lupus. Your vitamin D, if your rheumatologist or primary care doctor isn't emphasizing it, you should be asking them to check your vitamin D level and getting it to at least normal, which the number is 30. Vitamin D also plays a role in the immune system. Your inflammation can go up if you have a low vitamin D level. You can also create a leaky gut if your vitamin D level isn't high either. Dietary fat can also cause gut dysbiosis. Studies have shown diet high in fat and saturated fat can cause inflammation, and it can cause a leaky gut. So if you're overweight, try to exercise and eat a whole food plant-based diet. Emphasize fruits and vegetables to get the weight down. It will also help your lupus as well. Dairy. So dairy is emphasized a lot in the media, but it does not prevent bone loss. Studies have not been conclusive about that. I know we grow up and our parents tell us to drink a lot of milk so we can prevent fractures, but studies have not proven that. And some studies have even shown that it increases the risk of cancer, especially breast and prostate cancers. And it can also be inflammatory as well. When my patients come to my clinic, I tell them to stop drinking dairy. Some of my patients have been able to get off their medications for rheumatoid arthritis just by cutting out dairy. Some have been able to minimize their medications as well. So dairy is one of the first foods that I cut out of their system. And you might be wondering, why is dairy so bad for you? Number one, the hormones. Number two, the fat. It's high sugar content. And also there's proteins in there, such as casein and whey, that might not be healthy for us. Okay? That's why it can be inflammatory. Processed meat is very inflammatory as well. The World Health Organization has already said that it is a carcinogen. It's a class 1 carcinogen, red meat. It increases your risk of heart attacks as well. Processed meats are also one of the first foods I tell my patients to get off their diet. Ham, sausages, ground beef, you need to cut that out if you want to heal your lupus. This figure is from the New England Journal of Medicine, one of the premier articles in medicine. There's something called TMAO that's generated in our body. When you eat foods that are animal products, such as eggs, cheese, dairy, meat, especially red meat, it goes in your body, it goes to your intestines, and the bacteria in your gut, it converts that from choline, carnitine, to TMA, to TMAO. TMAO has been linked to heart disease, atherosclerosis. And if you have lupus, your chance of getting a heart attack, especially, there's a study done in women, it's 50 times higher than a person without lupus. So you really have to watch your diet carefully. Omega-3 fatty acids, we talked about that earlier. That's anti-inflammatory. Fish has been shown to be anti-inflammatory in our diet. However, you don't want to add a lot of oil on there, a lot of salt. You want to avoid omega-6 fatty acids. So omega-3 fatty acids are the good fatty acids, anti-inflammatory. Omega-6 fatty acids are the inflammatory fatty acids. And that can come from processed food, that can come from red meat, and cooking oil. Okay? So we want to emphasize omega-3 and de-emphasize omega-6 fatty acids. Salt is very inflammatory. There's been a lot of studies done on salt. It increases a signal in our body, in the immune system, called Th17, the T cells. That's high in lupus as well as a lot of autoimmune diseases. So if you're eating out, you're probably eating too much salt already. You want to salt to taste, okay? Cooking at home is the best for you. You can add salt, but you want to add amount where it satisfies your palate, okay? Not too much. Too much will be inflammatory and it can make you flare. As well, just while we're here on the salt side, I'll talk about sugar. Refined sugar can be very inflammatory as well. So refined sugar in ice cream, in candy, milk chocolate, okay? And even diet soda is very bad for you. It causes leaky gut. Diet sodas, diet drinks. So aspartame, that can make you not feel good, okay? So we want to avoid that. So the sugar in fruit is good for you because it interacts with the fiber and the phytonutrients. That's how it gets delivered to your body. So what should we be eating? So omega-3 fats, fatty acids, so you get that in walnuts. You can get that in plants as well as fish. Vitamin D is very important. Emphasize anti-inflammatory foods, salt to taste, minimize animal products, and most of all, emphasize fruits, vegetables, and whole grains. And the Canada, they actually came out with a new food guideline and food plate last year. And if you were at this talk last year, you will probably seen the slide. Most of your plate should be fruits and vegetables. A quarter of it should be whole grains. And the rest of it can be protein, okay? Whether it be from beans, if you like animal products, and just a little bit, not too much. And only water or tea. If you like coffee, you can drink coffee as well. It depends on you, how you react to coffee. Everyone's different. I hear some sighs. I think you are starting to hate me, and that's okay. My patients sort of hate me when they see me in clinic too, but they do get better when they try. So smoking, I think Dr. Sanju talked about this already. It's bad for lupus. It's bad for rheumatoid arthritis. They've done studies already where patients that smoke have a higher risk of getting lupus and also lupus flares. The double-strand DNA does go up a little bit when you smoke as well. When a patient has never smoked, it's a hazard ratio of 1, which means it doesn't go up. You're not at risk for lupus, and you're not at decreased for lupus. Sleep is very important as well. The optimum level of sleep is 7 to 9 hours, according to American College of Lifestyle Medicine. I believe that. Also dogs. Also dogs. Yes. Mm-hmm. Yes. Dogs. Your wife. Anybody. Your spouse, your husband. If you're not angry. So sleep disruptors, I'm not going to go through all of them. They're in your handout already. But I want to emphasize your blue light, your phone, your computer. You want to put these away with an hour of sleeping. Put your phone outside your room. Use a digital clock like the old days. I'm guilty of this. I do use the phone to read at night, but I shouldn't be doing this. Get the television out of the bedroom, okay? The bedroom is not for the TV. There's a lot of ways to sleep better as well. You can read these on your own. It might take me an hour to go through these, so I'll skip it. Exercising is anti-inflammatory. You need to exercise at least 150 minutes a week, which includes walking, stretching. Running for my patients is hard. Lifting weights might be hard. That's the end goal. You want to walk first. Walking is very good for you. Join walking groups. There's so many support groups out there. You have to move. Moving includes walking and yoga. Yoga, stretching is very important. And if you do exercise, it helps your immune system as well, okay? And it decreases the leaky gut, which we emphasize so much. You want to decrease the amount of leaky gut in your body. So this is a slide from Nature Reviews. It's a premier article, premier journal as well. So when you exercise, so when you have something called sepsis, that's infection. Sometimes patients come to the ER and the hospital for sepsis. They have blood possibly in their bacteria in the blood. So your inflammatory signals in your body goes up. So TNF is inflammatory signal that we give medications for in rheumatoid arthritis and so forth. These are also elevated in lupus as well. And if you have sepsis, it goes up, but eventually your body generates anti-inflammatory signals that decrease the sepsis. And that's how your sepsis resolves over time on top of medications. So if you exercise here, you see that there's no inflammation, but your anti-inflammatory signals goes up. That's how you can help your lupus. By exercising, you're sending anti-inflammatory signals in your body. Stress management, which we talked about in the last Dr. Deuce talk. I'm not going to emphasize this, but stress is so important along with everything else I've talked about. So in summary, minimize your animal products, eat a diet high in fiber, at least 30 grams a day, consists of fruits, vegetables, whole grains, get a full night of sleep, exercise, and manage your stress levels. I am on social media. I have 2 handles. My autoimmune MD, I talk about how lifestyle medicine can help with autoimmune disease in general. And the second handle is with my wife, Dr. Lifestyle 101. We talk about general lifestyle medicine factors that can help with overall health. We're on Facebook. We have a YouTube channel. It's a cooking show. It's a whole food plant-based cooking show. We just released our 3rd episode. We try to make it educational as well. There's a lot of Dr. Lifestyles out there, some with car shows. So you got to find us on there. That's a cooking. And one from Germany as well. And we do have a website, drlifestyle.org. It's used as a food blog. And we're going to be blogging about lifestyle medicine as well. And I do talk about some functional medicine, which I'm getting trained in for on my Instagram as well. And I think it's time for questions. Time for hate mail, I believe. Okay. So before I go on the first question, a whole food plant-based diet isn't the only diet that has been shown to put autoimmune disease to remission. The autoimmune protocol diet, there's a lot of diets out there that has shown to put autoimmune disease to remission as well, okay? So the first question is, what about chicken? Is that safe to eat considering that they are injected with sodium? So in the autoimmune protocol diet, I believe, and then paleo diet, they say that chicken's okay. On the whole food plant-based diet, we don't recommend chicken. So chicken has not been shown to be anti-inflammatory. Studies have been controversial. I think it depends on you and your body, whether it's gonna make your lupus worse or not, or flare. So if you're gonna get chicken, eat chicken breast only, and try to get organic, okay? I don't eat chicken myself. A whole food plant-based diet emphasizes it's a vegan diet without processed food. That's one of the most anti-inflammatories you can be on. But if you do want to eat animal products, chicken is better than red meat, and fish is better than chicken. Okay, that's the algorithm that I go by. Okay, because chicken does not have omega-3 fatty acids. It does not have fiber. So there's nothing really anti-inflammatory about chicken. Okay, the only good thing about it is protein, but you can get protein sources from plants as well. So gluten leaky gut. So I've done a lot of reading on gluten. So there's a lot of literature from gluten for gluten. One of the premier researchers from Harvard, and gluten can cause a leaky gut. Okay, but gluten causing lupus, gluten causing autoimmune disease is not validated in literature. So you can be eating gluten and not have lupus or have lupus flares. I don't tell my patients to stop eating gluten. So even though you have a leaky gut or your junctions in your intestines are opened up, doesn't mean that it will cause your lupus to flare. It doesn't mean that you will get autoimmune disease. So to answer your question, you can continue eating gluten. Everyone's different. Some patients, they cut out gluten and they do better on lupus. So there's no hard and fast rule just like Dr. Sandhu said, no two patients with lupus will present the same or react the same to medications. So is about nutrition and gluten as well. There's general principles about fruits, vegetables, and fiber, but there's no general principles about every single nutrient for lupus or autoimmune disease. The second question here, I'm having problems with my pancreas. My doctor put me on pancreas. If I could change my diet, would I be able to get off the pancreatic enzymes? I don't know. I'm not an expert on the pancreas. I would say you have to work with a doctor that knows something about lifestyle medicine. Ideally, you will be working with a primary care doctor or GI doctor that prescribes these medications, that knows something about nutrition. One thing I want to emphasize is that as MDs and DOs, we don't get taught nutrition in medical school, okay? We get less than 10 hours in nutrition. So you have to go to a doctor that has been trained in lifestyle medicine, that does a lot of extensive research on nutrition, and they'd be the best doctor to talk to. So I can't answer that question, unfortunately. What are your thoughts on almond milk? It's not dairy, but it has sugar. So almond milk is great, and there's non-sugar kinds out there. So I buy almond milk. There's no sugar in it. You can make it at home too. That's the best kind. Because when you look at the content on the back of your almond milk, there's things out there besides almonds and water. There's emulsifiers that make it more thick and additives as well. But you can also find ones that don't have additives. So you got to seek it out. Okay, you got to go to a more healthy food store like Sprouts, Whole Foods, Trader Joe's. They might have those, but you can make it at home. So I do make it at home as well. Eventually, we'll probably be putting on YouTube how to make almond milk. So almond milk is healthy. So is soy milk. So is oat milk, hemp milk, macadamia milk. There's so many plant milks out there now. You don't have to go with cow milk. Do nightshade vegetables cause inflammation? So this is so controversial. There is no scientific literature. So just let me backtrack. So nightshades are a group of vegetables that have, they're like tomatoes, eggplants, and potatoes, and peppers too. So some people say that it can cause arthritis and inflammation. If you look at scientific literature, it doesn't say that. There's also something called lectins in nightshades as well that can probably be inflammatory depending where you look in the literature. So it's not validated in literature, but I think you have to look at every person's different, whether you react to it or not. Some people will eat nightshades. I don't tell my patients to stop nightshades. I tell them to continue eating because a lot of people aren't eating the ideal diet to begin with. So getting rid of nightshades isn't going to change anything. So if you're eating a really good diet and you're noticing that you're still in pain, that you're still flaring, then cutting out nightshades might help, okay? But it's not validated in science yet. It might be in 10, 20 years. Okay. So I think that's all. All right, thank you so much.
Thank you very much, Dr. Yu.
Thank you.
We are going to have our final presentation now with Mr. Dojo Aguilar. Thank you, Dojo.
All right. Good evening, everybody. How is everybody? All right. So they always say that being the last speaker is actually both a good thing and a bad thing, right? The good thing about it being the last speaker is I could go on for the next 2 hours if you guys are up to it. But also the challenging part of it is I'm the only person between you and your beauty sleep or the traffic wherever you're going home. But hopefully I'll be brief, short and sweet. And really my goal is hopefully that what we all have learned tonight will hopefully just cause even just one change in your behavior, in your lifestyle, as patients and families living with lupus. Because we can learn all this information, but if we are not committed to do some changes, maybe to stop doing something, to start doing something, or even just try to improve on what you're currently doing, all right? So that's my goal tonight is I'm gonna kind of just summarize this. And so basically is I want you to remember 6 C's. And what I'm going to tell you has been said tonight, okay? But I love acrostics because it's easy to remember, right? I use the number 6 because it usually takes 6 years for lupus to be diagnosed. And I chose the word C because we live in California, okay? So hopefully that's easy to remember. So the first C is what you chow. I mean, Dr. Du, Dr. Yu, and Dr. Sandy have talked about this. And what I will tell you is your diet is actually not your diet, but it's your lifestyle. So we've heard about it, importance of not smoking, sleep, all right? So it's really about a lifestyle change. But the reason why I want to emphasize chow or what you eat or your diet, because that's almost what we do every day, right? We can't sometimes go on without a day without thinking about our diet. So when you think about what you eat, what you chow, it's also think about those other things. Do I exercise? Do I need to get more sleep? Do I need to stop smoking? How can I reduce my stress? Okay, so that's the first C, what you chow. Second C is cover up. And you guys all know this, the importance of really sun protection. Limit your exposure. We live in sunny Southern California where there's sun 365 days a year, okay? And they usually say that, sunscreen of more than 50 SPF is usually good to give you that ultimate sun protection. But also know that the sun is not the only source of ultraviolet rays, but there's also, other sources. So cover up. So that's the second C, all right? So what's the first C? What's the second C? Good, all right. So the third C is communication. Communication between you and your healthcare team. And remember, your healthcare team is not just your physician, your nurses, your MAs, your dietitian. And I'm pretty sure that for all of you here of lupus, you don't see only one physician, right? You probably see at least 2 or more physicians. Shared decision-making and open, honest communication is very important. And what I mean by shared decision-making is make sure that when you set goals on how you want your lupus to be managed, it should be something that's shared between you and your physician. And why I say shared decision-making is important, because if whatever the doctor tells you does not sit right with you, and you're not proactive in asking questions or being open and honest with your physician, what's the likelihood of you being able to comply with your doctor's instructions? Probably not, right? So it's really important that when you come up with a plan for how your lupus is going to be managed, make sure that this plan will also work for you, okay? I'll give you an example, right? I'm Filipino, I'm Asian American. Most Filipinos are scared of needles, all right? We just think that when we inject something into our body, right, it feels like it's the end, right? I have Hispanic friends too, the same thing, right? So if your doctor prescribes something to you for lupus that is injectable and you don't express your concern with your physician, what's the likelihood of you complying with that treatment? Probably low, okay? So that's just one of many examples. So really making sure that you have an open and honest communication with your healthcare team. Really talk about topics that may feel uncomfortable with you, okay? For example, if you're a young lady with lupus and just newly got married and you want to start a family, talking about pregnancy in lupus can be very challenging, all right? Especially if your rheumatologist is a male rheumatologist. But if having a family and starting a baby is important to you, make sure you talk those topics with your physician, all right? So that's the third C, having an open and honest communication. Listen to your doctor's instruction. Make sure that you take note of what they tell you and make sure that you stick to the management plan. And the reason why communication is important is we actually did a survey way back in 2011, and almost 1,000 members of the lupus community, including physicians, patients, caregivers, rheumatologists. And the survey showed that 52% of patients tend to minimize their symptoms when they talk to their physicians. Who among you here have done that? Minimize your symptoms. Okay? On the other hand, almost more than 2/3 of physicians were unaware that patients tend to minimize their symptoms. So you can see there's already that gap. So that's why it's very important for you as a patient to really have an open and honest communication with your physician. There are some tips for communicating. Make sure that report all your symptoms, regardless whether you think it's related to your lupus or not. Okay, very, very important. There's this Ask Me 3 program. If you're a newly diagnosed lupus patient, there's an Ask Me 3 program designed by the National Patient Safety Foundation. And basically it goes to 3 basic questions. What's my main problem? What do I need to do? And why is it important for me to do this? And I just want to quote this really nice, what Dr. Askanay said, who's a world-renowned rheumatologist from Columbia University. And she said why communication is so important. And she said, and I quote, "I have seen these challenges reflected in my clinical practice. It's critical that patients and physicians understand that the importance of clear communication because it has implications for disease management. For example, patients may not mention low-level disease symptoms as they may consider it a normal part of living with lupus. However, low-level disease activity can still cause organ damage and may represent a missed opportunity for identifying a flare and instituting early intervention." Okay. Communication builds relationship too. And as you know, that lupus is a chronic autoimmune disease. And so building relationship with your healthcare team, again, is so, so important. So fourth C. So we go with chow, cover up, communication. And the fourth C is probably one of the hardest things that not even patients do, or even us human beings are challenged with, is call for help, asking for help. And why is that very, very important? Because you know what? It's very, very practical. And I've seen a lot of lupus patients even struggle with this. Knowing that symptoms of lupus waxes and wanes, right? You have good days and you have bad days, all right? And sometimes it's very, very important to get that encouragement, whether from your spouse, from your friend. So even I want to give a shout out here to all the caregivers here, whether you're a spouse, a husband, a friend, because caregivers here play a very important role. Calling for help is very important in any kind of chronic disease management, because especially with lupus, right? Let's say when you have a doctor's appointment next Monday, and who among you here sometime just before that appointment, a day before the appointment, you just had a flare and you can't go to your appointment. But if you plan ahead of time and are comfortable asking for help from a friend and say, "Hey friend, I have this appointment, or I have my infusion this coming Monday. Will you, be available just in case if I don't feel okay the morning of my appointment?" Okay? I'd rather have someone drive you or take care of you to that appointment or infusion than you missing that appointment, okay? Because you're not gonna see your physician every week or every month. Sometimes it takes 3 to 6 months, okay? And getting that appointment. So that's the fourth thing I wanna encourage you to do. Call for help, all right? So what's the first C? What's the second C? What's the third C? What's the fourth C? Okay. Here's the fifth C, all right? Call for help. The fifth C is chart your symptoms, all right? This is very important. Who among you here journals or have done journaling? Okay, so you got a good amount. And the reason why this is important, because it's what even Dr. Askenis have said, never minimize your symptoms, whether you think it's related to your lupus or not. And it's important to chart your symptoms, because I don't know about you, but I cannot even remember what I ate yesterday, okay? All right, and no, I see some smiles. And knowing also that, again, symptoms of lupus waxes and wanes, and I know you could probably relate this. If at the time of your appointment, after waiting for 3 to 6 months, you're finally excited to see your doctor, but you've been feeling good the last 2 days, and especially the day of appointment, you feel good. When your doctor asks you, "Hey, Dojo, hey, Mary, how are you feeling?" What's your normal response? "I'm good today," right? "I'm good today, doc." But deep inside, a week ago, I wasn't good. 2 weeks ago, I wasn't good. But now I'm good, right? And we know, sometimes that, your lab tests may not necessarily correlate with what you're feeling, okay? And if the doctor sees all your lab results, it may be okay, normal, okay? But if you're not telling them all the symptoms that you've had for the last 3 to 6 months since the last time you saw them, then your doctor may miss something in terms of how they're assessing the level of your disease activity with lupus, okay? So charting your symptoms is very important because you wanna give your doctor, really tell them a pattern of your symptom over a period of time since the last time you saw them, rather than just telling them how you feel that day, okay? Because that's really how your physician is able to assess whether your lupus is active or not, okay? Because remember, lupus is not just one symptom or one flare, but it's very important to really assess, a pattern of your symptoms so that your physician can really make sure if your lupus is active or not, okay? So that's the fifth C. And the last C, okay, before I go to the 6C, so one of the things that I want to share with you is GSK actually developed this program called Us and Lupus. And Us and Lupus is more than just resources about lupus, but it really hopefully can give you the confidence by providing you the necessary tools and resources to better manage your lupus, and more importantly, to have a better engagement with your physician, okay? Because we also know our physicians are busy taking care of patients. And in as much as they want to have more time with you, but if they see 30 patients a day, most likely you only have 5 or 10 minutes with your physician. So it's important that you also, as the patient or family caring for that patient, you have to prepare for your appointment. So GSK developed this program called Us and Lupus that this is a free program that you can sign up. You can go online to go to usandlupus.com, and you can get these free resources in the mailed out to you. You will get a lupus checklist, a lupus impact tracker. My Lupus Log is actually that you can download it to your app store or to your Android device. You get a lupus journal, you get an appointment prep guide, and lupus dictionary, just to help you better understand some of the medical terminologies. I think I met a couple earlier that actually have been getting this, and they've actually, have seen this very important in the way they just track their symptoms. And the last C, okay? So what's the first C? Second, third, fourth, fifth, and sixth is connect, okay? Connect, all of us here have really emphasized the importance of connecting with a local support group, connecting with an advocacy group like Lupus LA. This is very important because this is where you get education. If you still have friends, families, neighbors that sometimes you wonder, like, I don't think they really understand what I'm going through as a lupus patient, right? Conferences like this is one of the best ways that you can invite them. Attend a walk, a lupus walk, and invite your friends so that they can see the lupus community, they get educated, okay? So hopefully next year we can fill up this auditorium, right, Catherine, right? Invite your friends, invite your co-workers, invite your boss, right? We've learned this from Dr. Du earlier that it's important, because mental health, sometimes you worry about, okay, I'm gonna miss my work and things like that. Get them educated, all right? So that's the 6C that I want you to be encouraged to connect, all right? So let's review this again. What's the first C? Second C? Cover up. Third? Fourth? Call for help. Fifth? Chart your symptom. And sixth? Connect. So was that hard? Okay, but again, more than just this information that Dr. Sandhu, Dr. Du, Dr. Yu, and myself have shared, I hope that you just take one thing, one learning from tonight, and make the necessary lifestyle change, because you as a patient, you should be your biggest advocate in managing your lupus. So just to end this, education is important. Be informed, be empowered, and also know that you are not alone, all right? As it always takes a village to manage any chronic disease, especially lupus. So ask for help, utilize your healthcare team, and utilize your family and friends. Again, you are not alone. Thank you very much.
you everyone for attending tonight. It was great to see you here. You had some wonderful presentations, so thank you. We do have surveys in your folders that we'd love to hear your feedback. They're on a white sheet of paper. If you're able to, please fill that out, and then you can just drop it off on the table on the way out. Thank you so much for coming. Again, my name's Catherine. If you have any questions, please let me know, and you can call me or email me anytime. Okay? Oh, yes. Thank you for reminding me. We'll do the raffle right now. 1 second. Thank you for reminding me. $154,801. 154,801. Let me go one more time. 154,801. Okay. 154. You got it? That's it. Got it. Thanks everyone for coming.